Hey guys, welcome back. This is a video I've been wanting to make for a while. This video applies to basically like anyone, regardless of which med school you went to, how good you are, how competent you are. You know, how to survive a surgery prelim. There's so many things out there about how surgery, the culture, it's toxic, you're overworked, everyone's depressed, blah, blah, blah. And, to each his own, of course. If you're going through a hard time, you should seek help. If you feel like the thing that you're doing is not for you, then you should pursue a change. But I just want to talk about how to survive a surgery prelim and tell you about my experience. And again, this information applies to everybody in the way that anyone can do this, can implement this advice without being super smart, without being super experienced. And I just want to tell you, I transferred from internal medicine to surgery, and my surgery experience has been a lot more comfortable than my medicine experience. So maybe not all programs are, maybe not what everyone says is true. But let me tell you some things I never did as a surgery prelim and some advice. So the first thing, never lie, okay? You're not expected to know everything. When you present to your senior, to your attending, even to when you're consulting, this stuff is important. Someone's life is in your hands. If my attending asked me what was this exam finding? Did you listen to the heart and lungs? I didn't get a chance to listen yet. I never lied. Never made up a physical exam finding that wasn't there. I never said if the patient was, let's say appendicitis, 7 days kind of guides management. If they asked me how long have they had pain for? If I didn't clearly elucidate how long, then I said I'm not sure. I was just honest. And being honest helped me so much because one, it's the right thing to do. The other thing is, then the attending just knew, okay, now when they go talk to the patient, they have to clarify this thing. So, you have to know your deficits. You shouldn't lie. The other thing is, I never went over hours. And how is that possible? I mean, if you're expected to show up at 5 a.m. and you show up at 4 a.m. because you want a pre-round and double, triple check every single, lab finding, I mean, that's on you. You can't blame the program because you showed up early and you stayed late when it was your choice. So I never went over hours. I showed up when I needed to. I did what was expected of me. I did what was necessary for patient care. I took care of my patients. You have to be efficient. You have to know how to quickly go over a chart and find out the things that are most important and, present them if it's time to present or whatever. You can't be inefficient. You're not a med student anymore. You can't go over hours. You can't lose sleep. I mean, you need to perform. So the best thing for you and for the patient is for you to not go over hours. Another thing you have to do is you have to ask questions. If you get a consult on a pathology that you know nothing about, and then you go see the patient, and you basically gather no information because you don't even know what to ask, and then you go present to your attending or your senior, and your presentation is, well, I'm not really sure. It's why didn't you just call your senior in the first place and say, hey, I'm not really sure what to look for right now. I'm about to go see this patient. I was consulted for this thing. Let me give you an example. I was on vascular a month ago, and there's a patient for limb ischemia. And you know what? I don't know exactly what to look for with a Doppler. I just don't. I mean, what's monophasic versus triphasic? What matters most? I didn't know. So I just called the fellow and I asked, hey, this patient consult, I'm going to see them. What should I look for? Because what do people want in the hospital when they're working? They want to be efficient. They want to save time. If there's a potentially critical patient, and you're going over there ignorant and you don't know what you're doing and you're too afraid to ask for help, I mean, you've just ruined your day and the attending's day and the fellow's day and the patient's life probably. So just do the right thing, ask questions. And this honestly goes hand in hand with the don't lie thing. If you don't know something, just say you don't know. Trying to know something in 2 minutes that really takes 3 months of studying or a residency's worth of experience is futile. Another thing that's important, keep it short. This is not internal medicine. You're not a med student anymore. You don't need to present normal findings unless it's a super pertinent negative. Your presentation should literally be a one-liner, and at the end, you have a plan, an assessment and plan. If you don't know how to present, then you need to work on it. Because a long-winded presentation, I mean, it's incredibly boring for the attendings, it's incredibly boring for your co-interns, and it's not going to help the patient. Alrighty, here's a big one. Trust your nurses and be polite, okay? Let's just call it like it is. You finished 4 years of med school. You have 2 years of medical school clinical experience where you've basically been shadowing and kind of presenting to your senior. And now you're 2 months into residency, you're 1 month into residency. You think you know something that no one else knows? Do you think you can recognize a toxic patient in 1 second? Or you know how to diagnose an acute abdomen just by your physical exam? The probability is that nurse that's 45 years old, that has 15 years of experience at this level one trauma center that you're working at, probably has more experience than you, more clinical experience. I mean, just flat out. So if your nurse tells you, if she messages you and says, or pages you and says, this patient is sick, I need you to come by, you got to trust your nurses. You got to go in there, you got to evaluate the patient, and then you have to ask the nurse too, what do you think is going on? And this has saved me multiple times. So be polite. Don't think you're so good because you're an MD, because you have 2 months of residency under your belt, because you matched the first time around. I mean, I know I didn't match the first time around, but still, just because everything has went the way you want it so far, and you're at your dream job at this prestigious academic institution, and you're a doctor now, you still have to trust your nurses, because this stuff is critical, and you can't be playing around. When it comes to trusting your nurses and be polite, the other thing I'd say is never argue, never get triggered. If I scrubbed into the OR and the scrub tech said, hey, I need you to rescrub, I just did that. I mean, it probably only happened once, but if a nurse told me that my management plan was terrible, I said, hey, I'll run up the chain, I'll ask my attending, I'll ask my senior. I never berated any nurse, I never yelled at anybody, I never lost my cool. It's just not worth it. It's just not worth it. You're already stressed enough, you're already working enough, you're already tired enough. Your perception and your control of your emotions is going to help you have a great experience or a terrible experience. So I never got triggered. If there was a patient safety issue, I just reported it. I'm not going to yell at the nurse. I didn't hire this nurse. This nurse, it's not my job to discipline the nurse. Okay, so don't ever yell at anybody, argue with anybody. This is a hospital. This is a professional environment. It's not worth it. Another thing I'll tell you is slow down. You got to calm down. I was just talking super fast right now, but sometimes you just need to slow down and think. And all right, recruit help, rally those around you to support you. So this is just part one. I don't want to blast you guys with too much information at once, but congratulations on starting your surgery prelim, and hope you can survive.